Welcome to The Explainer. All right, let's just dive right in, because today we are tackling one of the most critical, high-stakes skills you'll ever master in nursing. We're talking about the art and science of safe medication administration.
So, let's start with a question that really gets to the heart of what you'll be doing day in and day out. Just think for a second. Of all the tasks a nurse performs, what's the one thing you'll do constantly that also carries the biggest risk? If you are thinking drug administration, you are spot on. It's that simple, yet incredibly complex process of giving medication to a patient. And the reason it's so high stakes, well, you can see it right there. Errors can cause serious harm, or even death. The stakes literally could not be higher.
Okay, so before we jump into the how-to, we really need to understand the why. What's the mission? What are we actually trying to accomplish every single time we give a medication?
It's actually a much bigger mission than just treating a sickness. Of course, we aim to cure disease, but we also give meds to relieve symptoms, like pain. We use them to prevent illness, think vaccines. They can even help us diagnose conditions or replace something the body isn't making enough of, like insulin. It's a whole spectrum of care.
All right, now for the part that you need to practically tattoo on your brain. This isn't just for your exams, this is for your entire career. These are the 10 golden rules. Think of them as your personal shield against making a terrible mistake.
This number right here, 10. This is your new best friend. It's your safety net, it's your guide. I want you to burn this number into your memory right now because everything we're about to cover is built on it.
And here they are, the 10 rights of medication administration. These are completely non-negotiable. It starts with the 5 you probably already know: right patient, drug, dose, route, and time. But it doesn't stop there. You've also got to have the right documentation, the right reason for giving the drug, the right assessment beforehand, the right evaluation after, and, crucially, the right patient education. It's a full-circle safety system. And hey, lean in for this one, because this is a huge exam trick. If even one of these 10 things is wrong, just one, it is officially a medication error. Period. No wiggle room.
So, how do you make sure you nail all 10 rights every single time? Well, you need more than just a list of rules. You need a system, a workflow. Knowing the rules is one thing, but applying them systematically is what truly keeps patients safe. That brings us to your 4-step safety process.
I want you to think of this as your repeatable mental checklist. Step 1, you assess. Check everything: allergies, vitals, labs. Step 2, you plan. You're double-checking the drug, the route, and calculating that dose perfectly. Step 3, you implement. This is go time, where you follow those 10 rights to the letter. And finally, Step 4, you evaluate. Did it work? Any side effects? And of course, you document absolutely everything.
Awesome. We have the rules and we have the process. Now let's talk about the journey. We're going to explore the different paths or routes a drug can take to get where it's going and do its job.
We'll kick things off with the one we're all most familiar with, the enteral route. That's just a fancy way of saying the medication gets absorbed through the GI tract. Think of it as the main entrance.
Now, taking a pill, the oral route, is all about a trade-off. On the one hand, it's super easy, it's generally safe, and it's inexpensive. But the flip side is that it works slowly. It's obviously not an option for someone who's vomiting, and you have to deal with something called first-pass metabolism, where the liver chews up some of the drug before it even gets a chance to work.
And when you're giving oral meds, these basics are non-negotiable. Always give them with water and have the patient sitting upright to prevent choking. But this last one, I really need you to hear this. Never, ever crush enteric-coated tablets. That special coating is there to protect the patient's stomach. If you crush it, you destroy that protection and can actually cause harm.
Okay, so let's switch gears and talk about a completely different path, the parenteral route. This is when we bypass the digestive system entirely, usually with a needle, to get much faster, more direct results. First up is the intradermal, or ID injection. Look at that super shallow angle, just 5 to 15 degrees. We use this for things like TB tests because we want the substance to pool right under the skin and form a little bubble called a wheal. Key point here, do not massage the site.
A little deeper now, we have the subcutaneous, or SC injection. This goes into the fatty tissue and is super common for meds like insulin and heparin. The absolute golden rule here is to rotate the injection sites. If you don't, you can cause real tissue damage. And remember, some drugs, like heparin, shouldn't be massaged.
Going deeper still, we get to intramuscular, or IM.
Straight in, 90-degree angle, right into the muscle. This is how we give vaccines and a lot of antibiotics. Pro tip, the ventrogluteal site on the hip is considered the safest because you avoid major nerves and blood vessels. And you want to use the Z-track method to lock the med in and aspirate, that's a gentle pullback on the plunger, for most meds, but not for vaccines.
And finally, we have the express lane, intravenous or IV. This goes directly into a vein, so the effect is immediate. It's why we use it in emergencies. But with that incredible speed comes incredible risk. We're talking infection, vein inflammation, all sorts of serious issues. So your sterile technique has to be absolutely perfect.
Whew. Okay, I know that was a lot of angles, sites, and rules to keep straight. So let's pull all that super important injection info into one simple, powerful summary slide. This is your quick sheet for studying.
Look at this. This table makes it so clear. You can literally see the pattern. The shallower the injection, like ID, the slower it works. The deeper and more direct you go, all the way to IV, the faster the effect. This right here is absolute exam gold.
You know, we've covered a ton of technical stuff today, the 10 rights, all those different angles. But the big takeaway is this. Mastering these details isn't just about passing a test. It's about building a safety habit that will protect every single patient you ever care for. So I'll just leave you with this question to think about. Which one of these details could be the one that saves a life on your next shift?